session will be Dr. John Pertico, Associate Professor and the Dean of Behavioral and Mental Health Programs at Anna Maria College. He specializes in psychology, behavioral health, and social services. As a clinical psychologist and licensed mental health counselor in Massachusetts, he brings over a decade of experience in higher education. So please, let us all extend Dr. Pertico our warmest welcome. The stage is yours, sir.
Okay. Well, hello, everybody. It is bright and early in Paxton, Massachusetts. Anna Maria is located right in the middle of the state. What we're going to do today is just briefly review mental health and wellness. We will cover coping and self-care. And then we will conclude by having a breakout room discussion on implications for this content in the workplace. And then I was asked to kind of look up some mental health resources, and my understanding is that the Global Citizenship Foundation largely has physical locations out of Estonia and India. So we looked up some resources to provide for people living in those countries. As we'll note, there's a lot of virtual telemedicine services that can be provided to people living in rural areas. And some of these services in those countries can be important places for people to receive services and assistance regarding mental health. So we can advance to the third or fourth slide now. Just as a bit of a context, I'm the dean of the behavioral health programs in Anna Maria, so I oversee all of our social work and psychology and human services programs. I'm a clinical psychologist, and I've worked in a variety of settings, including outpatient, inpatient, schools, and all sorts, and community mental health centers in the United States. So we can shift one more slide. Thank you. So to kind of dive right into the content, what we're going to be talking about today is mental health in a broad sense. How does that apply to wellness? Mental health, just for the purposes of all being on the same page, is a state of mental well-being that allows people to cope with the daily stresses of life, realize their abilities, learn well and work well, contribute to their community, engage in healthy relationships, and generally live a satisfied life. What we unfortunately see is that when people are struggling with mental health, that can get to the point where it's getting difficult for people to not only function, but they can also experience different levels of impact in regards to mental health challenges, making it difficult for people to do things that they normally get enjoyment out of, or be able to function effectively. So the other thing I would like us to do is just kind of in the background, think about what are some of the ways that you might know that you or a friend or a colleague or a family member are doing well or not well in terms of health, wellness, and mental health. We're going to have a poll in a second that asks you to think about this more specifically, but generally speaking, think of some ways that mental health can impact you. Your presenters or your facilitators sent me some information with regards to a survey that had been done recently, and mental health, not surprisingly, was a big area of impact. So if you can take a moment to take this poll, I'll take a pause to take a drink of coffee, and I'll let you answer these questions. And give folks one more. It looks like I can vote myself. I'll talk for 1 second. If you're still taking the poll, that's okay. Not surprisingly, there's a variety of reasons that, or a variety of ways that people can, be affected by mental health. And generally speaking, what are some things that can cause stress for young adults? My understanding is that your organization tends to have a lot of younger adults, kind of coming out of adolescence and into adulthood. So not surprisingly, a lot of the things that are being noted in the poll sync up with young adults, with young adulthood, right? Career uncertainty. A lot of young adults are experiencing kind of that early career anxiety, so to speak, in the sense that they're just kind of getting their feet wet. Maybe the Global Citizenship Foundation is the first place you've ever worked as an adult, so kind of getting your feet wet in the workforce, requires a lot of learning new things. I'm a little bit older, so for me, my daily stresses, tend to come more from like family related expectations. So I'm more in that category. Young adults also are known for having kind of developmentally appropriate financial pressures. This makes a lot of sense with young adults, getting their first job, starting to get their feet under them financially. And then there's the social, implications that come with becoming an adult. So finding those romantic relationships and that kind of thing. Obviously, for the people who are who are also students, the academic related challenges is also a big one. I'm a college professor, so sometimes I'll do this presentation with college students, and not surprisingly, all of the things that coincide with school can be a source of stress for not just American students, but just students abroad as well. We can go to the next slide. And just a couple of quick facts about mental health. Some of them are related to the United States. Some of them are kind of extended internationally. So for the American college students, so there's a survey that's done nationally across the United States. It's called the Healthy Mind Survey. One big finding that came out of that survey in terms of its recent administration is that 60% of college students report meeting criteria for at least one mental health problem in the past year. You'll note that the year in which the survey occurred was also the COVID lockdown year for the United States, which was a very rapid transition and kind of unsettling year for a lot of college students. That said, if you look down to the bottom point on this slide, about 40% of people living in India report experiencing common mental health disorders as well. So one thing that we're seeing kind of across the globe is that there is a significant mental health effect that is kind of coming out of the pandemic. And there's a lot of research to suggest that the mental health effects of lockdown and other kinds of, COVID-related, environmental conditions has had a lasting impact in terms of mental health challenges. So to the points in the middle, American college presidents report that this is often one of the biggest mental health is one of the biggest challenges concerning college campuses. Our college president in Anna Maria noted that for many of the Northeast region college presidents, they are reporting that this is the biggest concern that the presidents themselves are addressing across their student bodies. And then for Estonia, one interesting fact that I came across as I was doing some research for your presentation was that as of 2008, there was no mental health policy in Estonia. And that has a lot of legislative implications in terms of if you don't have an established, government-based definition of mental health and mental health policy, it can be often very challenging to then implement services for them. Similarly, there was no, hard and fast definition for telemedicine. So that obviously presented a challenge for that country during COVID when many medicine-based services shifted to telehealth and telemedicine. We can go to the next slide to do one more poll. The next poll is more of a like a quiz style poll. But which mental health challenge do you think is most common amongst young adults? Let's see. There we go. So for the young adult population, is it anxiety, depression, stress and burnout, attention deficit hyperactivity disorder, or PTSD? We can share the results now. That's okay. So I can't see if there's any like percentile breakdown, but the most common, and we can go to the next slide to show folks the actual numbers. The most common one that we see based on the Diagnostic and Statistical Manual of mental health disorders is that just the anxiety-related disorders are the most common. That's not to say that stress and burnout don't occur, but in terms of diagnosable conditions, we see the anxiety disorders as being the most common, followed by something along the lines of a depressive disorder, so something like depression, general, major depressive disorder. It's also important to think about things like post-traumatic stress disorder, addiction and substance use, as being also very, very common, but not as common as the umbrella of anxiety disorders. So we can go to the next slide now. And actually, this is what I just was covering. So if you're looking at the different prevalence rates, these are the rates at which people report experiencing diagnosable symptoms to the extent that they could be diagnosed with a depressive or anxiety disorder in the past year. So generally speaking, 1 in 5 adults will qualify for a mental health challenge in a given year. So about 20%. And oftentimes, we'll see people experiencing different but similar challenges to mental health. So somebody with depression may later experience anxiety. So that 1 in 5, breakdown, 1 in 5 people typically also includes the statistic of people experiencing mental health challenges repeatedly or different challenges at a later point in their life. So we can go to the next slide now. I think I've got one more poll just to kind of get us, going. So one last one. This for now, this is more of a quiz style as well. In terms of the so generally speaking, and just to be very clear, every demographic group listed on these slides does experience mental health challenges or mental health concerns. But of the groups listed, which do you believe has the highest rate of mental health challenges? Is it men? Is it women? Is it students living abroad, LGBT individuals, or older adults? Give everybody another couple of seconds. Okay, so generally speaking, folks who are identifying as LGBT have the highest rates of mental health challenges in a given year. Actually don't have the numbers in front of me in terms of what the percentage is, but they historically are the highest affected group in terms of mental health challenges. In the United States, for example, there's a lot of stigma and negative social kind of implications that are associated with being gay, and that often places youth in particular under a heightened level of stress as the result of kind of feeling different than others, and certainly experiencing higher rates of discrimination and bullying associated with sexual and gender identity. So that typically is what causes folks on the LGBT umbrella to experience higher rates of things like anxiety or depression. But that said, though, students living abroad, we have a lot of international students at Anna Maria. And as you can imagine, the transition of going from living in Africa or Europe or Asia to the United States is extraordinarily stressful. That's worth noting. Older adults have their own challenges that they experience, especially with changes in social structures, no longer working, having spouses or loved ones passing away, kind of end of life related stuff. And then men and women each have their own challenges when it comes to mental health. But all of the groups are affected. It's just generally speaking, the LGBT individuals are the highest affected. And we can go to the next slide. Thank you. This is not a class in abnormal psychology, so we're not going to spend too much time going over specific symptoms. I would encourage you to look into this content more if you are interested in more clinical psych. That said, for our purposes today, what we're going to do is just cover broadly what is anxiety and depression, because as we just saw on the previous slides, those are the two most common things that will affect young adults and adults in general. And they occur a lot, and they occur a lot in a given year for individuals. And just based on the numbers, there's a chance that several people in the audience are experiencing challenges related to anxiety or depression right now, just based on the numbers and prevalence rates. So in terms of anxiety, you can go back one slide. So in terms of anxiety, it is worth noting what the different, physical challenges are that are associated with anxiety. So with anxiety, you often have kind of all of the different systems of the body being affected. So you have cardiovascular related impact. So meaning that often people who are experiencing panic attacks, for example, their heart will be racing. It might feel like they're having a heart attack when they're not having a heart attack. That's during like acute panic. But even if you're not experiencing panic, if you're just generally stressed or feeling anxious, you might be feeling like you have an upset stomach. So this is where more of the gastrointestinal and digestive systems get involved with anxiety. You might feel nauseous or have a lack of appetite. You also might see more kind of neurologically based impacts, meaning that you might feel, your musculature, you might feel restless, or you might feel like you've got trembling or upset, muscle groups, meaning that you might feel lightheaded, you might feel as if you're really tense, or you feel like your legs are not able to kind of hold you up easily because, anxiety and adrenaline in particular can affect the musculature differently than when you're not feeling anxious. And as you can imagine, beyond the physical challenges of anxiety, we also have the cognitive effects, meaning that often people with anxiety will experience racing thoughts. They'll often experience kind of a lot of hypothetical and catastrophic thinking, and usually in tandem with each other. So somebody who's experiencing anxiety might not only think about what they possibly did wrong, but they could extend it to, all the different hypotheticals of what they could have done wrong. And as you can imagine, that kind of adds an extra challenge. And then you have different versions of anxiety. For example, sometimes people become anxious in the presence of specific things. So things like phobias, for example. Other times people become anxious in more of a social context. So you see a lot of social anxiety, and we often see school-aged children experiencing school-related anxiety and all of the kind of unique social challenges that come with the school system, and on and on and on. So just for our purposes, that's just worth noting, is that anxiety kind of affects the body broadly, both in terms of gastrointestinal, muscular, and the adrenal systems being kind of some primary ones that we see physically. As you can imagine, both the physical and cognitive components of anxiety then lead to some specific individual behavioral changes as well. So not surprisingly, people who experience social anxiety will try to avoid social situations, or they will approach only certain kinds of social situations. Or kids with school anxiety will often not want to go to school because it makes them feel anxious. And you may see a lot of times these days, I see a lot of college students that are struggling to return to the quote new normal of the post-COVID world. So, for example, a lot of students in college, if they were at Anna Maria during the lockdown period, are struggling to kind of get back into the flow of college life. And if they're not in college, if they're returning to the professional world, those adjustments are pretty significant and worth noting. So with every mental health challenge, it's worth just clarifying. You have kind of biological components to them. You have kind of more cognitive components, and then you have behavioral. So thoughts, feelings, and behaviors are typically the easiest way to think about mental health challenges. So every mental health disorder, whether it's anxiety or depression or trauma or addiction, they have unique thought, feelings, and behaviors associated with them. Okay, so I'll move us along. I'm noticing a lot of thumbs up though, so I'll keep trying to earn my thumbs ups. So depression, let me just grab a quick second. So depression is the other common mental health challenge that I want us to cover briefly today. There's a lot of symptoms for depression. To be very clear, if there are any clinicians in the audience, yes, there are more than 2 symptoms of depression. But just for our purposes, in terms of things that you are likely to notice or recognize, both in yourself and more importantly in others, the 2 that are very common that we want to call forth for this audience would be one, being depressed or feeling sad or miserable is not surprisingly the most noticeable symptom in terms of it being one that people can easily connect to depression, right? So somebody who's feeling sad or depressed, that can be a sign that they're experiencing depression. So that's, obviously not the biggest insight. Somebody who's feeling depressed is going to possibly qualify for a depressive disorder diagnosis. But that said, though, that is one major symptom of depression, is feeling miserable, sad, or depressed. The other symptom that's worth noting is that there often can be a shift in the person's interest or pleasure in things that they normally find interesting or pleasurable. And so the way this tends to play out, the clinical term is called anhedonia, which is a lack of interest in daily activities, and they're commonly the activities that are known to be usually enjoyable for that person. So, for example, this can play out in a couple of different ways, but one workplace example might be the motivated employee who all of a sudden is not super motivated, or the very social employee who all of a sudden is not very social. There's obviously a lot of like work-related functional things that can happen, right? People who normally don't make a lot of mistakes at work, who all of a sudden start to make a lot of mistakes. People who are usually punctual, who all of a sudden no longer are punctual. The shift in and change is often what you'll notice. The way, well, actually, I'll hold off on that for now. The one thing worth noting is that somebody struggling with depression might show feelings of sadness and helplessness. They might cry, or they might not. They might not do any of these things. There's a bunch of other symptoms associated with these disorders that I'm not going over here for the purposes of time. But for example, disruption and disturbances in sleep and appetite are two classic things associated with depression. But also sleep and appetite disturbances can come up with anxiety and other kinds of mental health challenges. We can go one more slide, and then I'll just say one more thing. Typically, the way I try to break it down for students is that most people can recognize a mental health crisis, right? You don't need to know the person well. You don't need to kind of have a really unique understanding of the person, because a mental health crisis is one that's so extreme and severe that you're able to recognize it, right? So somebody who's in an acute psychotic state, somebody who is actively suicidal, somebody who's experiencing a drug overdose, those are so recognizable that you don't need to know the person very well. You can identify it in a stranger. Worsening or moderate mental health symptoms are the kinds of things that many people will notice, especially the people that notice you well. And the early warning signs and symptoms are going to be the ones that people that know you well are going to be able to recognize. So I mention this because every disease or disorder has a beginning stage, and if left untreated, can progress to a worsening, and if really left untreated, can blossom into some kind of crisis. So that said, often when it comes to things like depression and anxiety, the people that know you or really well are going to be the ones that can recognize those early warning signs and symptoms. If going back to depression, that shift in interest or pleasure in activities, those are going to be the things that your roommates will notice, your spouse will notice, your parents will notice, siblings, or your best friend, people that know you really well are more likely to kind of recognize, like, hey, are you okay? Normally you usually meet us for coffee or tea, but you didn't come to that today. Or we usually go out after work, and you say you haven't felt up to it lately. That's just one other thing worth noting. So early warning signs and symptoms of mental health challenges are going to be the ones that people that know you well are most likely to recognize. And then the moderate to severe ones, it kind of just depends on how well you know the person or how severe the symptoms are. So let's shift along to the coping and stress. I'd like us to take some time to think about how this applies here. So I don't want us just talking about the negative stress-related stuff. I want us to also talk about how we can cope and deal with that. I always like to introduce the topic of stress by kind of recognizing that stress isn't necessarily a bad thing in and of itself. And in fact, there's often a lot of good things that come with being stressed. If we were meeting in person, I would ask the audience to raise their hand if they self-identify as being a procrastinator, or somebody who waits until the very last minute to do something. So you're welcome to kind of give a thumbs up, reaction here if you're in that group, as a way to kind of there we go. We got a lot of people saying that they're in that group. And we got a couple of people throwing out some hearts because they love being a procrastinator. So the procrastinators in the audience will agree with me generally that a little bit of anxiety and a little bit of stress is what shifts you commonly from I should do that thing to I need to do that thing. So at least for my students at Anna Maria, when they have the last minute paper that they're writing, or they're doing that homework, or they're doing some, if they're working in the community, some work related task, a little bit of anxiety kind of helps here. And so in full disclosure, me preparing for your presentation today, there were a couple of things that I needed to do for your facilitators, and I didn't really worry about it last week. And then this week I started to think about it, and a little bit of anxiety about, like, my goodness, what if I didn't do those things? Those kinds of thoughts got me from shifting to thinking about maybe doing it to actually doing it. So it's worth noting that. And if you're a fan of sports, you'll also know that sometimes you experience stress with something that has nothing to do with you. So if you have a favorite sports team, for example, or athletic group that you like to follow. So I'm a big fan of, like, American football. Not surprisingly, I live in the United States, as well as the American basketball. So when my teams play, it makes me feel like I'm playing the basketball or football game with them. Watching your country compete in the World Cup, or watching or we have the Paris Olympics coming up. There's often your body will experience that stress as if you are the one swimming. And I actually saw somebody throwing out loving cricket. Yes, if you are in India in particular, you're going to be experiencing ideally some good stress related with watching the cricket matches. And the point there is that we don't want to walk away from this presentation noting that this is necessarily a bad thing. Now, that said, what you're seeing on this slide is kind of the difference between optimal level of stress and high stress. So the procrastinators in the audience know that when you don't experience any kind of stress, you're very unlikely to do things ahead of time. The number of times where procrastinators kind of go, like, I'm not going to worry about it. Or I don't know if you've ever watched a sporting event for a sport that you do not care about. You don't, if you're not into it, you're not stressed out about it. Right. So that's kind of showing on the left side of this slide, the idea that if you're not kind of keyed up, it can lead you to feeling bored or apathetic. Optimal level of stress, though, is what we're generally going for. I usually give another example here from the world of, like, dating and romance. So for those of you who have ever met somebody on a date, you want an optimal level of stress related to it. And I'm talking about, like, physical arousal in terms of stress, right? Nobody likes going on a date where or meeting a potential romantic partner where you're not feeling excited, right? You want a certain level of feeling keyed up. At the same time, right? So nobody wants you showing up to a date where the date doesn't care and they seem bored or apathetic. At the same time, I don't know if anyone's ever had the experience of showing up to a date and being overly anxious or overly stressed. And you certainly don't want that either. You want an appropriate level of feeling nervous, especially for a first date. That's very common. First time meeting somebody, that's often an area. And a job interview is another example. Showing up for a job interview, you have a certain level of, you want your interviewee to be, to be excited but not overly stressed. And I saw in the comment line with arranged marriages, you could still be anxious showing up to a first meeting for an arranged marriage. I actually have a student from Pakistan who had an arranged marriage meetup. She was still nervous because, even though it was arranged, it was like, I don't know if I'm going to like this person or not. With her example, she did have the choice to decline. But that said, there was a lot of, there was a high stakes meeting. Okay. The point here, though, is that you're looking for an optimal level of stress, not so stressed that you are seeing an impact on functioning, but enough stress that you're feeling like you're able to actually optimize. Right? You wouldn't want me so nervous about presenting to you that I'm flubbing the presentation horribly. You want me at the same time not so bored and apathetic that I don't care. You want me right in the middle, which I think I'm at right in the middle. So anyways, we'll go one more poll, and then we will shift into a little bit of a breakout room. And yes, same with India as well. I just saw that in the chat. Okay, last poll. And certainly, I know there are going to be things that you do here that you do to relax that aren't on here. But just in terms of making you make some choices, what are some of the ways from this list that you might relax or relieve stress? Oh, I guess I should click it myself. And certainly, all right, so we'll, I'm a big fan of cooking / eating. Yes, you are certainly welcome to, the facilitator just reminded me, you're certainly welcome to type in into the chat if there's something that you really want to share publicly in terms of what you do for stress relief. And, so yeah, for example, we got somebody who loves podcasts about horror stories or true crime. Those are very common ones. I'm a big fan of the cooking / eating. My mother is French and my dad is Italian. So that's a big cooking culture. So I definitely like to do some cooking. I'm the chef in our house, so my wife is not the main cook. But that's a big thing I like to do to cope. I also like to note that not every coping mechanism works in every situation. So cooking being a good example for me, it is not realistic for me. We can go to the wellness wheel slide on the next slide, because this gets us to talking about coping strategies. I'm seeing some good examples here as well of mindfulness, watching movies, exercise, physical exercise is another common one. We can go forward, I think, 2 slides to the wellness wheel. In terms of coping, it's worth noting on this slide here, we're seeing a common depiction of wellness, meaning that we often will see, it's often worth audiences to note that people experience health and illness in different ways. And similar to that, mental health and wellness are kind of broken out into different categories. So when it comes to being well, we often think about the physical components of health and wellness, but it's also really important to note that there's other areas and domains in which people can be well. So we'll start by talking about that, but I also want you in the back of your mind to remember that there's also different methods of coping using these different domains as well. So physical wellness is one that's very easy for a lot of people to identify, right? If you're not feeling physically well, that has an overall impact on your wellness. You know, if we're thinking from like a humanistic, approach, we easily can identify physical wellness as something that can impact your overall wellness, right? So if you're feeling, I have a colleague whose son is sick right now, and as you can imagine, he's not doing too great, just because he's got a head cold and he's not feeling good. That said, him not feeling good in the house is also putting a lot of stress on my colleague, right? Because she's a professor and is trying to, we're getting ready towards the end of the fall semester or the fall term. And, it's really not an ideal time for your kid to get sick, which is now putting a little bit of burden on her to try to do the last few weeks of class, final exams. Now she's trying to get some other things done on top of that, which gets us to considering some of the other domains, right? Social wellness. There are some people you might know who are doing well physically and emotionally, but they're not doing well socially. So it's important to recognize that social wellness is a big one. In fact, our our Attorney General in the United States declared that America has a loneliness epidemic occurring right now in the post-COVID world, meaning that so many people have been isolated for so long that especially in the older adult population, we're seeing a huge impact on social relationships to the extent that it's become very challenging for Americans who are notoriously, social creatures compared to other more kind of, kind of quieter and contemplative cultures. Right. I'm not mischaracterizing Americans as being overly extroverted, but we are seeing that in the United States, where even for a notoriously overly social group, garish group, we're seeing a loneliness epidemic. So that's a really important thing to recognize. It obviously extends from the lockdown scenarios that were happening a few years ago, but that gets us to considering the fact that social relationships are a big one. So a lot of young adults and early career professionals might be experiencing financial challenges. So that is also worth noting, right? You might be doing well physically, socially, emotionally, but you're not doing well financially or occupationally. And as you can imagine, not having a job or losing your job can be extremely stressful. Having a job that is very good and satisfying and provides a lot of emotional return for you and pays you well are very good things, but they might not be intellectually challenging, or they could be intellectually challenging. The point is there's a lot of domains to consider. Environmental factors are important to consider as well. For example, if you're a child living in a low socioeconomic group, so growing up in a poor household, I have a friend who is a big tobacco smoker, and his son is starting to pick up kind of physical effects. So his son is kind of being exposed to secondhand smoke, and kind of they don't live in like the cleanest household. So those environmental effects are having an effect as well. So stress in the home can be coming from the environment, or it could be actually just like the physical environment. And the point is, I'm trying to think of another example. Oh, if you are somebody who's not very messy, but you have to live with a messy roommate or a messy sibling, that's a nice example of environmental differences that can affect your wellness. Intellectual challenges often can be ones that come up with college students, right? Oftentimes, the university students want to challenge themselves intellectually. That's why they push themselves to seek out internships. They often seek out advanced coursework. They'll read for fun because, if you don't do that, for me, at the end of the day, I don't need to do a lot of intellectual stuff because I've been doing it all day. But on days when I'm not, I definitely feel the need to challenge myself and, use that as a method of coping. Spirituality is a really important one to note out here. It could be just as simple as a sense of spirituality, or that could be extended to formal religion as well. So you don't necessarily need to be religious in order to be spiritual. But spiritual wellness is a huge component of wellness for many people, and obviously for people who are formally religious, in the sense that you might be Christian, you might be any of the formal religions. That can be a huge component of wellness and a huge component of how you cope. So that's kind of a quick summary of a very broad topic. It's worth noting that these are some of the manners in which you might be physically unwell, but they are also the manner in which you cope. So, like on the previous slide, people were saying that, they were, you might see diet and exercise as a way of being physically well. You might see, breathing exercises as a way of coping with emotional panic. You might see mindfulness meditation or mindfulness exercises as a way to help both emotionally and intellectually or socially. So we're going to shift into breakout rooms really quickly. I'm aware of our time, but we'll do breakout rooms. I want to give you just some private time to be able to talk amongst smaller groups about how these kinds of mental health challenges are affecting employees in the workplace. So we have you have this wellness wheel. That's one place to start. We talked about some of the symptoms of common mental health challenges like depression and anxiety. You don't need to self-disclose, and I would probably encourage you not to do that. But I would say, in your breakout rooms, talk about what are some of the ways that stress plays out in the workplace. How does it affect employees? How does it affect individuals? What does management have to do with all of this? So let's do that. Let's give you a couple, I would say like 4 or 5 minutes to talk about it. Okay, let's see here. I think I'm back. We're back. Okay. All right. Got it. I hope you had a good conversation amongst yourselves. I was talking with the facilitators during the breakout room. So what we'll plan to do is I will plan to kind of wrap up our content in the next couple of minutes. And for my understanding is we can go a little bit over time, and we'll definitely do that for Q&A. So if we want to reopen the slide deck, I can just show you the one quick thing on slide 19. Generally speaking, the Harvard Business Review did a survey of executives in a lot of organizations, and the overwhelming majority of executives in businesses say it's important for organizations to talk about mental health and to make workforce related matters to mental health a priority, but only about 27% of organizations actually do it. Quick facts: the two main sources of stress, workplace stress for employees. The first one, not surprisingly, is being overworked, or if a workload related matters are a major source of stress for individuals. So not surprisingly, if you're overworked, that can be a source of stress. I just gave you the example of my colleague whose son is sick. That not only is putting a burden on her, but other people in the hallway need to kind of pick up for her temporarily. Like I'm going to be covering her class for later in the day. Some of us are picking, we're moving meetings around. So workload related matters can be a source of stress. And a surprising one for me was manager behaviors being number 2. So it was surprising for me as a manager to discover that my own behaviors can be a source of stress for employees. And then upon reflection, it's like, of course, that often can be a source of stress, right? Managers are often the ones telling you to do things, are often the ones setting deadlines and expecting you to go and do things, and they're holding you accountable. So yeah, it wasn't surprising once I actually thought about it. What is that wonderful, blissful ignorance of being a manager, where you go like, there's nothing I could have possibly done wrong to cause stress. So what we're going to do is I kind of provided a lot of resources to your facilitators. So I'm not going to review them here, mainly because so many of them are individualized. There are some here. The resources you're seeing here are just some basic overviews for human resource department and human resource representatives. There are some paid resources that HR HR reps can provide or pay for employees. In the United States, we often contract with different organizations to provide mental health services to employees that are struggling with mental health. Those are obviously paid services, but some of the links that are provided above are just good questions that you can ask your peers and ask employees about their mental health. And then we can skip this and because all this slide is showing is that when it comes to the conditions that will affect your ability to work, the mental health ones often are the disproportionately negatively impacting your ability to do work, more commonly than some medical conditions, which is often a surprising finding. And then the last few slides we don't even need to review, so we can drop down to slide 26, which is just my contact information. I will ask if possible, for your facilitators to share these slides with people. And certainly if we're looking at like a YouTube recording, you're welcome to pause at each of those slides. If you live in India or if you live in Estonia, I know that your company has those two major countries as employee sources. So there's telemedicine services that are listed for the country of India. India, for example, just launched a nationwide telemedicine service last year. And Estonia, a lot of the services are provided through the Department of Health. So that said, though, I'm not going to make any claims to the quality of those services, but I provided a list of ones that I was available for. I will say, though, as a cautionary note, when you're looking to receive mental health help, what a lot of the Eurasian countries are noting, or at least my colleagues that work, for example, in India as clinicians, they are definitely aware in the post-COVID world of a proliferation of not scammers, but of people claiming to be providing mental health services due to the disproportionate need for mental health services when they're not exactly qualified to do so. So just be sure to do your own due diligence, especially if you're seeking out and you have the resources to seek out private professionals and providers of mental health services. To make sure you do your own due diligence. So, for example, I was looking up some of these for India, and I stumbled across what looked like an amazing service provider. And I was getting ready to put them in as one of the hyperlinks. And at the very, very bottom of their slide, of their website, which is tagged in all sorts of social media, platforms, the very bottom of the slide said, actually, none of us are licensed, just fair warning, which was like, okay. And it looked at face value like it was a really good wellness provider, but it was a wellness provider. It wasn't a psychotherapy. It wasn't provided by licensed psychologists or clinicians. So anyways, with all of these services, you just be aware that you're wanting to do your due diligence there. This is my contact information for the United States. Anna Maria has its website. You can probably find me through that route as well. I want to open it up for Q&A. I know we've kind of extended into bonus time, but I wanted to give you all a few minutes to ask some questions. Is this a question coming from the audience? Let me just clarify. Yes. Okay. Are there coping tools or practices that can tangibly combat mental health issues like anxiety? Yeah. So one thing we talked about earlier was that wheel of wellness. What I usually encourage people to think about is building up a basket of coping mechanisms and strategies that work well for you. So, what works for me doesn't necessarily work for everybody. So some of this is a matter of knowing yourself well. I'll use myself as an example. So, we know that exercise and healthy eating are like two very common and well-researched coping mechanisms, right? Exercise and healthy diet are wonderful sources of wellness. Do I feel like working out and making a healthy meal at the end of a stressful day? That's a hit or miss. So, you have to kind of take yourself into consideration. I got some laughs on that one. So yeah, that said, though, I try to work out and eat healthy on days when I'm not stressed, right? So that way it's built into a larger package. Can you share any success stories where positive psychology played a significant role? So yeah, so my master's thesis was on positive psychology, which the way that I applied it was largely through the utilization of strength-based approaches to clinical services. So one thing I hope you've gathered out of this presentation is not only are there challenges that people experience when it comes to mental health, but they also have many resources and ways of coping with them. Right. So positive psychology, my approach to it commonly was kind of looking at not only what is going wrong in a person's life, but what are they also doing that's going well. So somebody who's struggling with depression, what are some of the things that they're still able to do? And what are some of the successes that they're still having, and highlighting it are really important things for me to note as a clinician, right? Who are the healthy supports in your life when you're struggling with mental health? That's a big thing worthy of note. So that's kind of the short of it for success stories, is kind of making sure that you're recognizing every person's individual success story as they're occurring. Depression has been a cause of suicide, and opening up is crucial for survival. How do they address the issue of fear and stigmatization with regards to this? So we provide a mental health, it's called mental health first aid. We provide this training to a lot of our students at Anna Maria. And in that training, there's a video that we show where two people are talking about depression, and in the vignette, the person is struggling with, he's worried that his dad is suicidal, and he certainly feels like his dad is depressed, but he doesn't know how to talk to him about it. And this is an Asian American family. And so he basically just says, like, in my family, we don't talk about this kind of stuff. And the friend in the vignette says to the character, like, you just have to recognize that, like, the person is suffering in the dark, and all you're doing is just shining a light on it. So there's a common myth with suicide that by mentioning suicide, it puts the thought in somebody's head. And that's a longstanding myth that doesn't tend to bear fruit. So having the conversation with somebody that you trust, and knowing to take it seriously is an important one. That said, it is very commonly the case that mental health is stigmatized negatively, and you add a cultural flair to it depending on where you come from. Where you come from in my family is often the way that it kind of bears out there. So that's kind of my general suggestion is, trying to at least have the conversation about it. When it comes to suicide and any other kind of mental health crisis, you're wanting to gather information from a clinical perspective, knowing that information is being folded into your clinical assessment. That's easy for me to do as a psychologist and say, because I have those kind of difficult conversations professionally. But it's not my daughter, it's not my wife where I'm having that. And with those kind of family and friend level, that's where a lot of the discomfort can come up. But having the conversation, knowing that you're not forcing the conversation, is an important one. And yeah, that would be one suggestion. Just having the conversation, starting with how you doing, I'm worried about you, is often an easier stance than asking, bluntly, are you feeling suicidal? Is it possible that a depressed person may become completely okay by changing his or her situation circumstance? So let's start there. And then there's some other questions. So is it possible that a depressed person may become okay by changing their situation? Yes. And a depressed person may be completely okay by not changing their situation. One thing that's always nice to note is that sometimes people, when it comes to mental health, they don't receive treatment for it, and the symptoms go away on their own. Just like how when you have a medical condition, sometimes the condition resolves itself without any kind of treatment or intervention. Now, that said, we know because of the stigma associated with mental health that often there is a big gap between the emergence of symptoms and actually receiving treatment for those symptoms. So for people in which those symptoms aren't going to go away on their own, this can be a huge lag, but where people are going to be suffering in somewhat a preventable or avoidable way. When it comes to situationally based sources of stress, it's often the case that, if you're really stressed because you have a stressful job, changing your job will remove that stressor. And being in a difficult relationship or a toxic relationship, removing yourself from that relationship will remove the toxicity. So those are kind of shorter examples of changing the situation, often allowing you to then feel better. There was another question built in there. I'm sorry, I didn't see it though. Can you recommend specific mindfulness exercises that individuals can practice? So I won't recommend specific ones because what works for me won't work for you. I will recommend that you find a specific exercise or practice that works for you. Because I used myself personally, I personally don't like mindfulness exercises in which I am kind of expected to be going along in a guided image, or if I'm supposed to close my eyes and listen to a meditation. Those are ones that make me feel really uncomfortable, not because I'm hyper caffeinated, but it just is not part of my personality. So those types of exercises are really beneficial to other people, but not me. So I've got actually somebody in the comment talked about listening to, staring at the stars, and I think it was just staring at the stars was one. I'm more likely to do that as an example of mindfulness. I'm more likely to go for a walk and listen to music, or I'm more likely to go for a walk and not listen to music and just listen to the leaves and sticks crunching under my feet as I walk. I'm more likely to kind of cook in silence, as a way to kind of give myself a quiet. That's how I practice mindfulness. But knowing that there are some of you that are like, that sounds terrible, listening to those. So that I would recommend that you find some specific exercises. There's a lot of apps out there for smartphone users. There's a lot of, web browser based activities. So my suggestion is find them. And actually there used to be a couple of websites that were just like giant lists of mindfulness activities as a starting point. So find a specific thing that works for you, but they're very individualized. We used to do, when I was doing group therapy more commonly, we would have this mindfulness activity where we would take like 15 minutes to eat a piece of fruit. So it would be like 15 minutes to like peel and eat a banana or peel and eat an orange. And that stressed a lot of people out. And then there were others that just loved the idea of taking that much time to mindfully eat a piece of food. All right, meditation or therapy for medication or therapy for depression and or anxiety, or when does it get to the point of medication? So these are great questions to ask your doctor, is typically what I recommend here. I've seen it work in both directions, where I've worked with people where the therapy side of the treatment is not as effective as the medication side. I've seen the opposite, and I've seen both or neither working well. Like I said, there are some folks, just the nature of their mental health challenges are ones that go away with no intervention, whether it's medical or therapeutic. I've seen ones where it's very beneficial when it's both. I've seen ones where the medication is better than the therapy, or vice versa. So they're great questions to ask your doctor or your providers. Why are humans neurologically wired that they don't do things which are good for them, like physical exercise or mindful exercise, with the interest when they eat junk food or lie on the couch? So I usually joke so that mental health first aid training, it's like a 9-hour training that I do as part of a class. So like I'll get to the classroom at like 8 a.m. and I'm leaving at like 6 p.m. And I always joke that I'm the biggest hypocrite, because we spend the whole day talking about mindfulness and wellness, and then I'm going to go home and eat Netflix, eat Doritos and watch Netflix because I'm exhausted at the end of the day. So that said, though, that is definitely a day when I'm not likely going to feel up for doing physical exercise or mindfulness. And that's okay to do every once in a while. I think what the question here is kind of implying is when people have that as kind of their standard lifestyle, that's where it's like I have a friend who is a tobacco user and he smokes cigarettes, and he's in a similar pattern where it's like, why do you do that? That's not, we know that that's not good for your health. Your doctor tells you it's not good for your health. You're coughing and you're talking about how there's all these other negative health effects. Why don't you just quit smoking? And it's easy for a non-smoker to say that, but just because people are doing unhealthy things doesn't mean that they're not aware that they're not unhealthy. But there usually are some secondary benefits to it. So the short answer to this longer question is that people are usually doing what they're most capable of doing in a given moment. So I don't want to necessarily say like just sitting on the couch and eating junk food is the best that they can do in a given moment, but it might be. I mean, depression is extraordinarily debilitating to some people, and it might on outward appearances look like the person's not doing much to take care of themselves, and that might be the case, that all they're able to physically gear up for is that. And then for other people, it's just a matter of shifting from thinking about doing healthy coping to actually doing it. Or it could be neither of those things. So in what way can an organization seamlessly integrate mental health initiatives into its existing frameworks? So the slide I provided earlier for human resources is a nice starting point. Enduring a cohesive and sustainable approach. So one thing we have to recognize is a lot of organizations say that it's important, but there's not that many that do things related to it. We actually, at our college, we introduced a mental health day where all of the students have classes canceled for the day. And then we added a bunch of like wellness related initiatives that the students were encouraged to go to instead of going to class that day. So we had like 6 months lead time on planning for a day where we canceled class and we surprised the students with the announcement. This was the first time we'd ever done it as a college. It was maybe like a month and a half ago now. So that was one example of something where we were hearing a lot from the students that they were feeling stressed and overwhelmed. And one day off out of an entire semester was not grossly impacting the curriculum. So that's one thing that we did. And then we also, as a faculty body, try to regularly do things to support ourselves. So twofold. If you work for a small team, this is a conversation to have with your small team. And then this is also something for like middle management to bring up to senior leadership. So with your small team, it could be as simple as like, hey, do y'all want to go out after work? Or do you guys during work want to go and do something? Again, every organization is different. Every employer and employee groups are different. But it was a colleague's birthday 2 weeks ago, so we got the person a birthday cake, and we all kind of moved our meetings around to give ourselves like an hour to just get around. We normally don't eat lunch together as a group, but we did for that day. So they could be small things if you have a small team where you can do that. I know a lot of your employees are virtual or working in different parts of the world, but trying to organize kind of social meetings can be a fun one too. That would be. But again, every place is different. How to start reaching out for help? Is it like a psychologist or psychiatrist or counselor? So yeah, it really depends on your part of the world. It really depends on your part of the world is going to be the short answer, because what's a psychologist in Brazil is going to be different than a psychologist in the United States. And the easiest ways to get triaged into different services is going to be very country and region specific. And just speaking for the United States, the process would be different in different states. In the United States, I usually recommend going with starting the conversation with your doctor. If your doctor, for example, is your primary care physician or your pediatrician, but starting with a known medical provider can often be an easy way to get going, get the ball rolling. I have some people I've worked with where their primary care physician is the one that prescribes the psychiatric medication, because the mental health condition is not one in which the primary care physician feels incapable of prescribing medications for. But I would say you have to it goes region by region. I provided some examples on the slide, so let me look up here really quickly. For Estonia, the EHIF seems to be one of the starting points, and for India, it looks like Telemanas is another potential starting point, but don't quote me on those necessarily. But those would seem to be two places to possibly start. Psychiatry typically tends to be more on the medication side. Psychology tends to be more on the therapy side. What are the chances of success once mental health treatment is initiated? Are there cases that are too severe to deal with? A lot of times, that's a tricky one to kind of answer. But generally speaking, generally speaking, in my experience as a clinician, the utilization of mental health services will increase the chance of success more often than not. That's not to say that there are some people who do get worse during the therapy process, because that's just like with medicine as well. There are going to be some people whose prognosis worsens over the course of treatment. So you see that with mental health services as well. But generally speaking, it's the gap between the onset of symptoms and the provision of service that leads to the worsening of symptoms for mental health challenges. So so that's really the main point, is we want people to start receiving services before they worsen to a point that it is too severe, versus waiting for a mental health crisis to occur and then react to it. If that makes sense. That's kind of the bigger thing I want people to think about, because it's going to be on an individual case-by-case basis in terms of the severity. And chances of success for a treatment, symptom remission is going to just go on a case-by-case and disease/disorder by disorder basis. I think that was our last question.
Yes, that was our last question. So thank you,
Okay.
Dr. Portico, for your very insightful and engaging presentation on the topic. Thank you, everyone, for accompanying us on this wonderful occasion, and we sincerely hope that you have found value in this experience. If you want to be a part of the process of building such experience, applications for the Mentor Intern Program of the Global Citizenship Foundation are open until the 25th of December. So you can reach out to us through the email sent in the chat box for any inquiries. We hope to see everyone again soon. So once again, thank you, Dr. Portico, for your very informative session.
Thank you.